Welcome, everyone, and thank you for joining today's OnBoard limited release training for healthcare providers.
All right, so to start things off, we'll provide a quick recap of OnBoard and what the Phase 1 release will include, as well as a timeline of what's to come. Next, we'll provide a quick overview of registration and administration information for OnBoard. Then we'll dive into the specifics of using OnBoard limited release, including how to access the system, delegate roles, how to submit a request for decision on unpaid medical bills, which is Form HP 1.0, and how to submit a medication prior authorization request in the system, as well as a walkthrough of what is included in your dashboard, and lastly, the complete process of a medication PAR as it navigates from a provider submission through the various levels of review. Then we'll end with providing you the location of where OnBoard training resources reside. OnBoard limited release has digitized and streamlined various PAR processes, including MTG confirmations, MTG variances, MTG special services, and non-MTGs over $1,000. Remember, as you submit prior authorization requests in the system, you will not need to specify which PAR type it is. The system will automatically do this for you based on the information entered. OnBoard introduces new PARs that can be submitted. Medication PARs in this system will replace the current drug formulary prior authorization request process. OnBoard will also add PARs for durable medical equipment and non-MTG under or equal to $1,000. Lastly, requests for decision on unpaid medical bills, Form HP 1.0 submissions will be done in OnBoard. The rest of this process will be the same as it is today, outside of OnBoard. We will detail the instruction of Form HP 1.0 submissions and the medical PAR processes in this webinar. OnBoard limited release is being rolled out in 3 phases. The first phase, which we are training today, includes medication PARs and Form HP 1.0 submissions. Note, Phase 1 includes medical marijuana requests done via a medication PAR in OnBoard. Phase 2 will introduce durable medical equipment submissions to OnBoard on April 4th, 2022. Lastly, Phase 3 will introduce the remaining PAR submissions for treatment and testing. Treatment testing will include MTG confirmation, MTG special services, MTG variances, non-MTGs over $1,000, and non-MTGs under or equal to $1,000. Registration information has been available on the medical portal web pages, but as a reminder, ensure that you are all set for OnBoard. All providers who currently have access to the medical portal will automatically be registered for OnBoard limited release. Visit the medical portal web pages for healthcare provider registration and administration information. OnBoard administration ensures you have the proper access to the system with your assigned delegates ready to draft PARs, which must be reviewed and submitted by the healthcare provider, to draft escalations to level 2 medication PARs, which must be reviewed and submitted by the healthcare provider, draft PAR escalations to level 3 for medical director's office review, respond to insurer requests for information, must be designated by the healthcare provider from within OnBoard, and draft and submit request for decision on unpaid medical bills, which is Form HP 1.0. Before we dive into the system, we'll provide a quick recap of what a delegate role is within the system for healthcare providers. Providers are able to assign delegates in the system who can draft PARs on their behalf. When a delegate drafts a PAR, they will include all details required for the PAR submission. However, it will only be saved to the draft eForms queue, where the delegate can edit it at a later time. Other delegates assigned to that provider can edit as needed, or for the provider to view and submit. Within the medical portal administration pages, there is a distinction between provider delegates and billing delegates. Users who are assigned as a provider delegate can draft PARs on behalf of the provider for the provider to submit. Provider delegates can also draft and submit Form HP 1.0s. Users assigned as a billing delegate can only draft and submit Form HP 1.0s on the provider's behalf. If the provider uses a billing service and wants them to submit HP 1.0s on their behalf, the provider will need to set up user accounts for any employee of the billing service who will be allowed to submit an HP 1.0 on their behalf. Remember, the healthcare providers themselves are required to submit a drafted PAR. Details on how this is done is shown later on in this training. Healthcare providers can designate multiple delegates to draft PARs on their behalf. If a provider has multiple delegates, the delegates will see all PARs drafted and submitted by other delegates and the provider. Lastly, users can be a delegate for multiple providers. All right, let's begin by showing how to access OnBoard limited release from the board's website. OnBoard limited release is accessed through the board's medical portal. If you're not registered for the medical portal, view the medical portal access and administration web pages for healthcare providers. In the teal bar at the top of the board's website, locate the Online Services drop-down list on the right. Select the down arrow to display the list of services and select Medical Portal. Then select Log In. Enter your medical portal ny.gov ID, username, and password to enter the medical portal. For healthcare providers, an OnBoard logo is displayed next to Prior Authorization Request, PAR, and Request for Decision on Unpaid Medical Bill, Form HP 1.0. These links will take you to your OnBoard limited release dashboard. The drug formulary prior authorization link will only be used to view previous requests and will only be available for 30 days after OnBoard goes live. All prior authorization requests are now done using the Prior Authorization Request PAR link. All in-flight requests will be transferred to OBLR to be completed. We'll start with a quick overview of the initial sections of your dashboard, like what you will see first, how to see account information, and navigating the dashboard before diving into the PAR and HP 1.0 process. The home screen for OnBoard is a view of My Dashboard, which allows you to access all active, resolved, drafted, and submitted prior authorization requests, or PARs. The default view is the Prior Auth Active tab. The My Dashboard link in the navigation menu will take you to this home screen. The My Downloads menu link lets you view documents that were downloaded in the last 24 hours. Use the My Profile drop-down menu to select either My Account, My Organizations, or to log out. Selecting My Account will allow you to add or edit your phone number and manage your notification preferences. You will not be able to edit the username or email address here. Changes to a username or user email address need to be done in the Medical Portal Administration application by the online user or administrator. Notification preferences alert healthcare providers by email or SMS text message when a new item has been added to the dashboard. For providers to receive text message notifications, the phone type must be set to mobile. Select Save after any changes are made. My organizations will show each organization with which you are associated. The organization's type, name, and start date are listed, as well as your role within the organization. Select the name of the organization. Additional details will be displayed. Selecting the Update Provider Delegatory button in the Overview section lets you change the Allow Provider Delegates to respond to Insurer's request for more information option to a yes or no. If the provider selects yes, all of the delegates for that provider will be allowed to respond to a request for more information. Selecting Log Out will log you out of your account. This will only exit the OnBoard application. You will not log out of the medical portal. Anytime you exit the OnBoard system, please use the Log Out button. If you have completed your medical portal session, it is highly recommended that you log out of the medical portal and then close out of your browser entirely to ensure that you have signed out. If multiple users are using the same PC, this is recommended between each user's session prior to the next user signing in. Next, we will provide instructions for healthcare providers on how to submit a request for decision on unpaid medical bills, Form HP 1.0, within OnBoard limited release. From your OnBoard dashboard, select the Submit a Request button on the top right and select Decision on Unpaid Medical Bill HP 1.0. For a request for decision on unpaid medical bills, Form HP 1.0, to be processed, it must first be matched with a claim within the system. To begin, enter the WCB case number or the claim administrator claim number. The claim admin claim number is the same number as the carrier case number. Next, enter the information for 2 of the following 4 fields: date of injury, last 4 digits of a social security number, date of birth, or patient last name. Then select Search for Claim. When a matching claim is found, the search results will appear. You may then continue with your request. After conducting the claim search and matching to a claim in the system, you will enter the user information. The provider's name will be selected automatically if the provider is submitting themselves or if a user is only delegated to submit on behalf of one healthcare provider. If the delegated user can submit Form HP 1.0 for multiple providers, they must select the provider's name from a list of providers. If the provider has only one medical license, the form will automatically fill in the license information. If there is more than one medical license, select the correct license from the drop-down list for the HP 1.0 form being submitted. Select Provider/Supplier button to continue. After ensuring the user information, the healthcare provider will continue entering information as applicable, including an FEIN or social security number, phone number, and email, confirming if the billing address is the same as the mailing address shown. If it is not, you will enter the correct billing address. Select Form C8.4. The receipt of notice of refusal to pay all or a portion of a bill due to valuation objections, Form C8.4, from the claim administrator determines if your submission is timely and determines how it will be resolved. Next, you will complete Form C8.4 if applicable. Enter the medical bill submission date and indicate whether you received Form C8.4 from the claim administrator. If you have, select Yes and enter the date the claim administrator issued the valuation objection. Otherwise, select No. Select the Form C8.1 button to continue. The receipt of Notice of Treatment Issue/Disputed Bill, Form C8.1, from the claim administrator determines if your Form HP 1.0 submission is timely and if it can be submitted. If you have not received Form C8.1, select No. If you have received Form C8.1 from the claim administrator, select Yes, and then enter the legal objection date issued by the claim administrator. Indicate if you received a Notice of Decision, Form EC23 or PD-NSL, resolving the legal objection that was not appealed or objected to by any party, and if you did, whether it was resolved in your favor. If it was resolved in your favor, enter the filing date of the Notice of Decision. This can be found in the lower right-hand corner of the decision. Select the Medical Bill button to continue. Complete the information for the medical bill. Select Documents to continue. The final step is to upload required and additional documents. If you're submitting Form HP 1.0 due to receiving Form C8.4, you are required to upload a copy of the medical bill and Form C8.4. If there are multiple medical bills, the additional bills can be uploaded in the Additional Documents section. The recommended document format is PDF, but other acceptable formats include text, spreadsheet, and images. Non-PDF files will be converted to the PDF format. Lastly, the maximum combined total for all uploaded documents is 30 megabytes. Select the upload buttons, the medical bill, and other documents as applicable. Select Browse to locate the document on your computer and then enter a description of the document. Select the Upload button to upload the document. Once uploaded, you will see the file name, type, and description. If your document description needs to be edited, select Update Description. You can also remove the document if needed. Select the checkbox next to the affirmation to affirm that 1. The attached medical bill or bills was submitted to the responsible insurer/self-insured employer for payment, and 2. Proper payment in accordance with the applicable fee schedule has not been received, and 3. That you will abide by the New York State Workers' Compensation Board's decision. Before submitting, you can preview your Form HP 1.0 as a document. Select Preview to display the PDF form. After selecting Submit, you will see a confirmation page with the e-form details. You can print, download, or view the completed form. In your OnBoard dashboard, your submitted form will appear in the Submitted e-forms tab. Next, we will walk through submitting a Medication Prior Authorization Request, or PAR, in OnBoard Limited Release. To create a medication PAR, select the Submit a Request button on the top right of your dashboard. Select the Prior Authorization PAR link. First, you will complete the information for the provider making the request. A provider's name will be selected automatically if submitting on behalf of themselves, or if a user is only delegated to submit on behalf of one healthcare provider. If a delegated user can submit requests for multiple providers, they must select the provider's name from a list of providers. If the provider only has one medical license, the form will automatically fill in the license information. If there is more than one medical license, select the correct license from the drop-down list. To begin, enter the WCB case number or the claim admin claim number. Next, enter the information for two of the following four fields, either date of injury, the last four digits of a social security number, date of birth, or patient last name. Then select Search for Claim. If a claim is not matched, check the criteria you entered or add new search criteria and search again. If there is no match for a PAR, you can continue with the submission by selecting the link to proceed without a matching claim. Then enter the known patient and claim details. After your submission, the board will attempt to match your request with an existing claim. If a claim is found, your request will be forwarded to the insurer's claim administrator for response. If a matching claim is not found within 5 days, your request will be closed and you will be notified. The patient should then be instructed to submit a claim and notify their employer of their injury. After a claim search, you will begin with your PAR items. Select the medication PAR category. On March 7th, the only PAR option available will be medication. On April 7th, durable medical equipment will be available, and on May 2nd, you will be able to select any of the categories. Selecting Save adds the first medication PAR item to your PAR submission. You can select Add Another Item, as shown in the image below, to add additional medications. Details for each request will be added after selecting the Complete Requests button. Select the Complete Request button to continue entering information for the first medication PAR. You can save as a draft at any time by selecting the Save as Draft button on the top right of the page. Your draft will be saved under the Draft eForms tab in your dashboard, where you will be able to select it and continue completing the request later. If you entered information for multiple medications or other PAR types, each PAR will be saved as a separate entry in the Draft eForm queue. Draft eForms are removed if they are not submitted within 30 days from the date that they are created. After a therapeutic category is selected, new fields will automatically show for additional required information. Select Medical Necessity / Supporting Medical. Enter or upload a document providing all the relevant clinical information to support the request. Include narrative, progress notes, and other supporting documentation, for example, symptoms, justification for initial or ongoing treatment, diagnostic testing, equipment, etc., any contraindications or adverse effects experienced, and if applicable, evaluation of efficacy for previous treatment or medication. The recommended document format is PDF, but other acceptable formats include text, spreadsheet, and images. Non-PDF files will be converted to a PDF format. Lastly, the maximum combined total for all uploaded documents is 30 megabytes. To upload a document, select Upload Relevant Clinical Information. Select Browse to locate the file on your computer. Enter a description of the document if necessary, and select the Upload button to upload the document. You should receive a confirmation that the document was uploaded successfully. If there are more documents to add to your request, select Upload Additional Documents. Select the Review and Submit button. Review all details to confirm the accuracy of your submission. Select the Preview button to view your PAR as a generated document. If you are a delegated user drafting the PAR on behalf of a healthcare provider, select the Ready to Submit button. This will add the PAR to both the delegated user and the healthcare provider's draft eForms queue with a status of Ready to Submit. The healthcare provider must complete the process by signing and submitting the PAR. Drafted eForms will be automatically removed from the system after 30 days if they are not submitted. If more than one medication or a different PAR category was requested during the requested items step, you will be presented with the next medication or PAR request to complete the details for that PAR. Each PAR will appear as a separate entry in the draft eForms queue for both the delegated user and the provider. Then select Finish when done. If you are the healthcare provider and created the PAR, select the Attest and Submit button. Provider delegates cannot attest to or submit the PAR. If a delegate created the PAR on your behalf, open the PAR from your draft eForms queue and review the PAR details. You may change the request details and statement of medical necessity or upload different or additional documents if necessary before selecting the Attest and Submit button. The provider is required to understand all aspects of the attestation presented to them before submitting a PAR. Select Submit to attest and submit the PAR. A confirmation page will show, confirming your PAR medication submission, which includes the time frame for an expected response. Then select Finish when done. After the PAR is submitted by the healthcare provider, the drafted PAR for both the delegated user and the provider will be moved from the Draft eForms tab to the Submitted eForms tab and the Prior Auth Active tab. You can view the recently submitted item in your dashboard in the Prior Auth Active tab. The due date column will update with the date that the claim administrator is required to respond. All timeframes for claim administrator review and response are automatically tracked by the system. If the claim administrator does not respond within the designated timeframe, an order of the chair may be issued. The current activity column will show the level of review of the request. An initial submission will be Insurer Level 1 review. In the Submitted eForms tab, the status column confirms that the PAR submission has been completed. After a medication PAR submission, an insurer will review and provide a response. This next section will give you an example of how an insurer response will show in your dashboard, how to review the response details, and how to proceed. When the claim administrator's reviewer responds to your request, the Active tab on the dashboard will update with the new information and show in bold letters. The provider and any delegates will get an email or text message based on their notification preferences in the OnBoard user's profile, advising that action was taken on the request. If the PAR was granted by the claim administrator, the board's medical director's office issues a notice of decision. The PAR will appear on the Resolve tab. It is recommended that the Resolved tab be checked at least daily for final decisions made on PARs. If any other action is taken on a PAR, it will remain on the Active tab, and the Current Activity column will show the current status. To review the response from the claim administrator, select the PAR ID link to access the PAR details page. In the Request Items section, select the Level 1 or Level 2 Insurer response details as appropriate. If the medication PAR received a grant in part or a denial, providers can escalate the medication PAR to a Level 2 review with the insurer or a Level 3 review with the medical director's office if the Level 2 response was a grant in part or denial. Healthcare providers have 10 days to escalate a medication PAR that was granted in part or denied for a Level 2 or Level 3 review. The date by which it needs to be escalated is shown in the due date column on the Active tab. In this example, Level 1 response in the Level 1 response in the current activity column is Review Insurer Level 1 Grant in Part, and the provider has until December 16th, 2021 to escalate for Level 2 review. To escalate a grant in part or denied medication PAR to a Level 2 review, select the Actions button on the top right of the PAR details page. Note, a delegated user may draft the escalation rationale, but the provider must submit the request. Rationale for the Level 2 request is required. After reviewing the summary of the request, enter the rationale in the text box under L2 Request Details, or upload new or additional supporting documentation by selecting Upload Relevant Clinical Information. The request details should specifically address the rationale provided by the reviewer for the denial or grant in part. Once the information is added, either select Save as Draft or Submit. If a delegated user drafts the escalation request, they will see a Ready to Submit button. The request must be submitted by the provider. Drafted escalations can be found under the Draft eForms tab on the dashboard. Provide a reason for the escalation in the Escalation Reason text box. Specifically, address the Level 2 reviewer's stated rationale for the grant in part or denial. Provider delegates can submit a Level 3 escalation. Once entered, select Submit. After submitting, you will see a confirmation page where you can print, download, or view the completed eForm. The Level 2 or Level 3 request will appear in your Submitted eForms tab. The Level 2 or Level 3 request will be updated under the Prior Auth tab in your active PARS queue. The current activity column will change to Insurer Level 2 or 3 Review. When the board's MDO makes a decision regarding your request, you will receive a notice of resolution. The determination by the MDO for medical necessity of MTG-related procedures, DME, or medication requests are final. The PAR will be moved from the Prior Auth Active tab to the Resolve tab. It is recommended that you check your Resolve tab for final decisions daily. Selecting the PAR ID link will open the PAR details page. You'll be able to view, download, or print the notice of resolution from the Documents section on this page. After submitting or escalating PARs and HP 1.0 forms, you can view all PARs in the system via your OnBoard dashboard and dive into the complete details of these PARs or HP 1.0 submissions. In any dashboard tab, you can sort the columns on the dashboard using the up or down arrows in each column. You can filter some columns by selecting the filter button in the upper right corner and then selecting a column from the drop-down menu and entering your filter criteria. Some filter options will allow you to filter information based on just a few characters, for example, patient. Other fields, such as PAR ID, require the full ID. The active tab in your dashboard can also be exported. This will export every PAR in the active tab to a .csv file. The Active tab provides detailed information regarding the status of active PARs the provider has submitted for review. Final decisions on PARs from the claim administrator or the board's medical director's office will not appear under the Active tab. Instead, they will appear under the Resolved tab. The dashboard defaults to show PARs based on due date, but they can be sorted by any column on the dashboard. If the status of a PAR has changed since the last time you logged in, the row will be displayed in bold. The PAR ID is a link to detailed information submitted on PARs. The type is the type of PAR that was submitted. The due date is the date the claim administrator needs to respond to the PAR or the date the provider must escalate by if requesting the next level of review. Current activity is the latest activity that occurred on the PAR. Providers may see provider response requested in this column if the claim administrator's reviewer is requesting additional information to process the PAR. Assigned organization shows who is working on the PAR. If the provider is shown in this column, the claim administrator reviewer may have requested more information, or the claim administrator's response to the request was something other than grant. PAR status. This shows the level of review and the latest status. Examples of types of PAR status on the Active tab include, but are not limited to, awaiting WCB case number, L1 requested, L2 denied, L1 denied, L2 requested, L2 granted in part, L3 review requested, L3 review no response. PAR status date is the date of the last activity that was taken on the PAR. The prior auth active table columns starting from the left are PAR ID, type, due date, patient, date of birth, current activity, injury date, and WCB case number. The prior auth active table columns continued. Assigned organization, assigned user, claim admin claim number, claim admin, insurer, provider, PAR status, and PAR status date. The Resolve tab displays a list of PARs for which no additional action or activity is allowed or required of the healthcare provider. For example, if the payer has granted or denied the PAR and the time to escalate has passed. PARs that cannot be escalated and have received a final decision from the payer of the board medical director's office appear under the Resolve tab. It is recommended that you check your Resolve tab daily for final PAR decisions. Examples of types of PAR status on the Resolve tab include, but are not limited to, L1 granted final, L2 granted in part final, L3 granted final, denied final, OOTC issued grant. The Draft eForms tab will display any PARs or HP 1.0 forms that have been drafted but not yet submitted. Select the Draft eForm name link to open and complete the draft. If a delegated user completes a PAR on behalf of a provider, when they select the Ready to Submit button, it will add the PAR to the Draft eForms queue of both the delegated user and the provider with a status of Ready to Submit. The healthcare provider must complete the process by signing and submitting the PAR. Drafted eForms will automatically be removed from the system after 30 days if they are not submitted. To delete a draft, select the Actions button in the corresponding eForm row to discard the draft. The Submitted eForms tab will display all PARs and/or HP 1.0 forms that have been submitted. Drafted PARs for a delegated user and the provider will be moved from the Draft eForms tab to both the Submitted eForms tab and the Prior Auth Active tab after the PAR is submitted by the healthcare provider. To view the documents generated by the eForm submission, select the link from the eForm document column. You can print or download a copy by selecting the Actions button in the corresponding row. Documents generated in OnBoard Limited Release will show within the system. The tabs we just reviewed give you an overall picture of all active, resolved, drafted, and submitted eForms, as well as navigating to and from My Dashboard, My Downloads, and submitting an item. The next section will dive deeper into the dashboard, focusing on viewing the PAR details for the requests that are in the system. PAR IDs are linked in your dashboard. Select the PAR ID link to show all details associated with the PAR. The PAR details page shows an example of a durable medical equipment request details page. Selecting from the list of links will allow you to jump quickly to a specific section of the page. The first link to select is Related Entities and Users. Selecting one of these links will jump directly to that section of the PAR details. Related Entities and Users will provide the healthcare provider, payer, and claimant information associated with that PAR. Selecting the link for the healthcare provider or payer from the Related Entities and Users tab will take you to that entity's information page. Next is the Request Details section. This will provide all requests and response information for that PAR. The example below shows a medication PAR that was granted in part from the Level 1 and Level 2 reviewer, the reviewer's names, and the date and time for each submitted review. Further information about each review response can be seen by expanding the blue highlighted sections of Additional Request Details, Level 1 Insurer Response Details, and Level 2 Insurer Response Details. In this example, all sections are expanded. At the bottom of this section, additional PAR details can also be expanded for more information. The Medical Necessity section will show the statement of medical necessity entered in the text field during a PAR submission. If a statement of medical necessity is attached instead of entered on the eForm, this section will be blank. To see the attached statement of medical necessity, go to the Documents section. The Documents section will update with a new generated eForm when a PAR has been submitted or responded to in OnBoard Limited Release. Documents the provider or their delegate may attach when submitting a PAR or responding to a request for information from the claim administrator will also appear in this list, along with any documents that are attached by the claim administrator throughout the review process. Related PARs will show any prior authorization requests that have been submitted on the same claim. Correspondence history will show correspondence between the provider and the claim administrator when there is a request for additional information. The comments column will show the details of the request. To view the full text, hover your mouse over the response text until a box with the full request details appears, or select the Actions button. To respond to the request for more information, select the Actions button on the right and select Response to Insurer. The pop-up enables you to enter the requested information into a text box and/or upload a supporting attachment. After the response is submitted, the correspondence history activity column will be updated with the provider response submitted, which will also be a link to a pop-up showing the response, including links to any documents that were attached to the response. If documents are attached, the checkbox in the supporting attachment column will be checked, and the documents will also appear in the Documents section. Related activity will display all the various activity conducted on a PAR request. This section will be updated with completed items or action items that are ready for review. Please navigate to your dashboard for further information regarding open requests that may be assigned to you. The board has developed a training webpage for healthcare providers. Please see the OnBoard webpage for more information. The healthcare providers section of the board's website have user areas that provide links to the OnBoard overview, which contains high-level information about OnBoard and OnBoard limited release, and a training page that has detailed instructions of all the tasks performed in OnBoard limited release. Other resources are also provided, including fact sheets, registration instructions, past webinar recordings, and more. To view the detailed instructions covered in this webinar, the training web pages will provide you with various links as needed. More pages will be added as each OnBoard limited release phase is rolled out, including instructions on submitting a DME PAR and treatment or testing PARs. To show an example, we will view the medication PAR training page. These instruction pages feature linked sections on the left side of the page. These will take you directly to these sections to view the instructions you need as you work within OnBoard limited release. Phase 2 will add durable medical equipment PARs to OnBoard limited release on April 4th, 2022. Phase 3 will add treatment/testing PARs on May 2nd, 2022. Prior to each phase, we will be conducting webinars similar to today's webinar. To receive these updates, make sure that you're subscribed to receive notifications. You can subscribe on the board's website. For questions or more information, you can send general OnBoard questions to onboard@wcb.ny.gov. For other questions, contact customer service at 877-632-4996. We will be sending OnBoard related emails throughout WCB notifications, so make sure to subscribe. Lastly, we encourage you to visit the instructions created at wcb.ny.gov/onboard. These instructions dive into all aspects of OnBoard limited release.